Kia ora everybody, good afternoon. Today I'm joined by Dr Ian Town, the Chief Science Advisor for the Ministry of Health, who's here to talk about planning on boosters and also the ongoing global developments around Omicron. I've also got Dr Danny Delore, who will be here to talk about the Pfizer doses for 5 to 11-year-olds. Dr Delore might be a new face to some as we enter this new phase in immunisation for our tamariki. He's a paediatrician at the Rotorua Hospital, chairs the Indigenous Child Health Working Group of the Royal Australasian College of Physicians, and is an honorary lecturer at the University of Auckland School of Medicine. He's been involved in giving advice on the rollout of the program for young New Zealanders. Yesterday, Cabinet met to discuss our plan to reduce the threat of Omicron to New Zealand as we accelerate our booster program. And we've received further advice on that overnight. Omicron is now in more than 70 countries around the world, and last week we too detected that variant at our border here in New Zealand. All evidence so far points to Omicron being the most transmissible variant yet, and public health advice suggests that soon every case coming in through our border into our managed isolation facilities will be the Omicron variant. Our immediate job right now must be to slow it down and to delay it from entering the New Zealand community for as long as we possibly can. So Cabinet has agreed to a suite of precautionary measures which I'm going to outline now. So first to boosters. We already know that boosters, the booster vaccinations significantly lift an individual's immunity, reducing the spread and the severity of COVID-19. The advice from our COVID-19 Technical Advisory Group is that shortening the period between the second dose and the booster dose of the Pfizer vaccine is an appropriate and pragmatic step that we can take in line with what other countries are doing. Data is emerging now that booster doses of Pfizer provide better protection than 2 doses do when it comes to the Omicron variant. While it appears that 2 doses is likely to hold a good degree of protection against severe disease from Omicron, a 3rd dose is likely to offer greater protection against transmission of COVID-19 and also reducing the chance for severe infection. So yesterday, Cabinet endorsed the decision by the Director-General to reduce the time frame for people to get their boosters from 6 months after their second dose to 4 months after their second dose. That means that around 3 million vaccinated New Zealanders will be eligible to get their boosters before the end of February. That's 82% of everybody who's currently fully vaccinated. The shorter time frame will start in early January. Initially, people will be able to walk into vaccination clinics, and then subsequently, once the Book My Vaccine system is fully updated, later on in January, they'll be able to book in, and we'll set out specific time frames for that as soon as they've been confirmed. Importantly, the schedule ensures that those who are harder to reach within our community, particularly parts of the Māori population who have only recently been fully vaccinated, they'll be able to get their booster doses before winter when the threat of the virus is at its greatest. We remain open to the science and whether we reduce that gap down further will be very much informed by that. Cabinet also agreed in principle that where workers are required to be vaccinated, this mandate will now also extend to booster doses. So initially, it will be for those workers who are most likely to come into contact with Omicron, our border and our health workers. They'll be required to have their boosters by the end of January, or not later than 6 months after their second dose for those who have only recently been fully vaccinated. It will then apply to all others covered by a vaccination mandate from the 1st of March. Already our MIQ and border and health agencies are contacting staff who are eligible for a booster, and we're seeing really encouraging uptake. As of today, 55% of our border workers eligible for a booster at 6 months have already had one. And of course, more people will be eligible as a result of the changing timetable. Secondly, we turn to the border. Since the start of the pandemic, we've worked really hard to provide as much certainty as we can for people who are travelling and who are needing to travel. But as everyone will appreciate, certainty is sometimes hard to offer in a very uncertain situation. Cabinet has decided to push back the date for self-isolation for those travelling from Australia from the 17th of January to the end of February so that we can accelerate the rollout of that booster program and have as many people boosted with their vaccination before we have people isolating at home across the international border. Around 3 million New Zealanders will be due to get their booster by the end of February. And assuming most of this group get their booster on time, at that point we will be far better protected from Omicron. We know that this delay will be disappointing news for those who have booked travel or who are expecting arrivals from Australia. But with the march of Omicron and New South Wales now expecting to be recording 25,000 cases a day by the end of January, opening the border in mid-January as planned simply presents too high a risk at this point. In addition to those measures at the border, the requirement for travellers to New Zealand to return a negative pre-departure test will reduce from 72 hours before departure to 48 hours before departure. When we introduced that requirement, testing was not as widely available as it is now, and people should be able to get their tests within 48 hours. In terms of our MIQ stays, they're currently 7 days, followed by 3 days of self-isolation at home with a negative day 9 test. That will be extended to 10 days in managed isolation with a negative day 9 test. That precautionary measure has already been in place for passengers on flights where an Omicron case has been identified. And thirdly, to the vaccination of our 5 to 11-year-olds. Following MedSafe's approval of the paediatric dose for children aged 5 to 11 last week, Cabinet has confirmed that our vaccination rollout for this age group will begin on the 17th of January. We'll take the lessons from our initial rollout and we'll apply them here, including reaching more rapidly into remote or hesitant communities and providing vital information to parents and caregivers as an absolute priority up front. While vaccination of children will always be a choice made by parents, I can't speak strongly enough in the interests of our collective safety for children as the last unvaccinated group in New Zealand, and for the older people and more vulnerable people in their lives, particularly their grandparents. I can't speak strongly enough of the importance of vaccination. Countries around the world are now rolling out vaccinations to this age group, and I want to underline that it is safe and it is necessary. Finally, to the traffic light system and the decisions that we made earlier this month, which remain as they were at that time at the moment. Cabinet did confirm yesterday that in the event of community cases of Omicron, the first response will be to use the traffic light framework rather than the previous alert level settings. In moving to the COVID-19 protection framework, or the traffic light system as it's commonly known, we did signal that we'd be adjusting to more of a reactive stance when it came to protective measures, and that we would apply those additional restrictions and those additional protective measures as case numbers grew and the health system came under pressure. Omicron has changed the dynamic again. When it does arrive, we expect that it will spread fast, and that's what we're seeing in other places. So to slow that spread, we may use that red traffic light setting earlier on in order to try and slow that spread. That'll give us the best chance of minimising the chances that we'd need to return to something more restrictive. It's not our intention to move to lockdowns unless that is absolutely necessary in the event of a widespread outbreak where our health system comes under considerable strain and the overall health risk becomes too much to bear. And even then, our strong preference would be for any lockdowns to be highly targeted. Faced with alternative courses of action and looking at overseas jurisdictions, Cabinet is strongly of the view that this is the best approach. By keeping Omicron out for as long as we can, we increase the likelihood that businesses can stay open and we can keep our plans for summer in place. For people who want to travel overseas or to come home, we are aware that today will not be welcome news. But it's important to set these changes out as clearly as we can, as early as we can, so that people do have time to consider their plans. As COVID-19 keeps throwing new curveballs in our direction, we have to respond in a way that continues to protect the lives and livelihoods of New Zealanders and avoids putting in place restrictions and lockdowns unless they are absolutely necessary. While I know everybody wants certainty, certainty has been a rare commodity for the whole globe through the entirety of this pandemic. What I can say with certainty this afternoon is that we've got a system that's been built to adapt to new challenges and one that will go the distance. Today we've further strengthened the settings which will continue to carry us through the next wave of challenges around COVID-19 that we expect Omicron to throw up. I'll now go to Dr Town, then Dr Delore, and then we'll open up for your questions.
Thank you very much, Minister. Tēnā koutou katoa. As chair of the COVID-19 Vaccine Technical Advisory Group, or CVTAG as we call it, I want to first shout out to the members of that group, an extraordinary group of scientists and clinicians from around New Zealand. They have had over 39 formal meetings and produced 28 pieces of formal advice to the Director General. A big shout out to them and also other members of our other technical advisory groups that have played such an important part in helping the government chart the course through this challenging period. So as the Minister has said, in the light of experience overseas and emerging evidence with Omicron, the Director General has recommended that the interval between the second dose and the booster dose be advanced to 4 months. This is to ensure that everybody has the opportunity for a booster dose before winter next year. We've recommended as a committee that that booster should be offered to adults 18 years or over after the completion of that primary two-dose course. Priority, of course, as it was in the initial rollout, should be for those at risk of exposure to COVID-19 or at risk of severe disease once contracting COVID-19. So this includes particularly Māori and Pacific peoples, those aged 65 years and older, and those with pre-existing medical conditions that puts them at higher risk from severe outcomes. Just thinking about our elderly, since the start of the pandemic, there have been over 900 people aged 60 or over diagnosed with COVID-19, and in this more recent outbreak that started in August, just over 500 cases have been documented in those over 60 years of age. As you know, our Māori population has accounted for a high proportion of cases in the current outbreak, so improving vaccination rates and the addition of a booster is the best way we can protect this population. Our frontline border and healthcare workers are also a top priority, as they were in the early part of the Pfizer rollout, and so the addition of that booster is the best way we can protect them, particularly with the cases appearing in MIQ over the last week or so. So because we started our rollout in that group, our border workers, healthcare workers, and of course older people and those, as I've mentioned, with pre-existing conditions, are in fact already eligible for a booster. We're in a good position now across the country with 95% of people over 65 fully vaccinated, including high rates for Māori and Pacific. District health boards have active outreach for boosters to residents in aged residential care who are also at greater risk, and are planning for vaccinations to be offered for new residents who move in over the coming weeks and months. So far here in New Zealand, over 216,000 booster doses have already been administered. That's around 60% of those who are currently eligible. The Ministry has advised that boosters for people aged 18 years and over who have had their second dose at least 4 months ago will be available in the new year. Thank you, and I'll hand over to Dr Delore.
Tēnā koe, Dr Town. Tēnā koe, Minister Hipkins. Tēnā tātou katoa. The Māori paediatricians that I've been working with welcome the government's decision to make the paediatric vaccine available for tamariki, aged 5 to 11 years. This is an important decision, particularly for tamariki Māori, who would likely bear a disproportionate burden of this disease without the protection of vaccination. We believe tamariki Māori have a right to be protected against COVID-19, and they have a right to participate in the wider protection of their communities. Māori paediatricians have provided technical advice in the lead up to this decision, along with other Māori health professionals and Māori organisations. We've specified that a successful vaccination program for 5 to 11-year-olds will be a program for whānau, one that allows parents and caregivers to receive reliable information and discuss that information with people they trust. one that engages effectively with whānau of tamariki with disabilities, one that allows whānau to access other vaccines on the routine vaccination schedule, and COVID boosters for young people and adults. A successful program will be delivered in partnership with iwi and Māori health providers, including sharing of data. Māori and Pacific organisations have already demonstrated that they know how to deliver vaccination programs effectively in their own communities. As Māori paediatricians, we're encouraged to see the government making a commitment to by Māori, for Māori input, including ongoing technical and implementation, communications and delivery of vaccinations. And we look forward to immunisations for tamariki starting on 17th of November. Kia koe tarako. Minister, back to you, Minister.
Kia ora, thank you. All right, we'll open up for questions now. We're going to start over here.
Kia ora, tēnā koutou. Why aren't tamariki Māori being prioritised in this rollout?
We are fortunate that we will have enough supply of the vaccine when it arrives to be able to start everybody all at the same time. What I indicated before, though, I think learning from our experience with the adult rollout, I think we need to make sure that we're devoting specific dedicated resource to reaching into those harder to reach communities, particularly some of our more remote communities, and many Māori live in those more remote communities, earlier on in the piece rather than later on. So we know that we can make these vaccines available widely right from the beginning. We won't have to ration, if you like, as we did with the adult rollout. And that means that where we focus our additional resource, so that surge resource, we can make sure that we're reaching into those communities that we know we need to do better. And that does mean that we'll be able to do that earlier on, like right from the beginning. And I think that will allow us to reach Māori earlier.
A good portion of tamariki Māori are at schools decile 1 to decile 4. Why isn't the vaccine program going to be rolled out into these schools?
We will be working alongside schools. What we're not saying is that we're going to do it in every school, because in some schools that wouldn't make any sense. If you're in a highly urban area where there's vaccination clinics everywhere and it's not hard to get vaccine, setting up additional vaccine clinics isn't necessarily the best use of that additional resource. On the other hand, in some of our smaller communities, so if you think about Northland, for example, it's a great example, sometimes the schools will be the centre of that community, and that is a good opportunity to vaccinate not just the tamariki, but also to provide the opportunity for their whānau to come in and be vaccinated. And we can also make sure that we're providing through that people who are informed and who can talk people through what the vaccine is and what it does and how it works, because we know that that's where some of the hesitancy in parts of the country have come from. So I think this really is a good opportunity now for us to not just reach the tamariki, but also reach into some of the adults who may not have been vaccinated yet either.
The Tribunal report has found that the government and the vaccination rollout has actually breached Te Tiriti o Waitangi. What's your response to that?
Look, I want to take the opportunity to study that report closely, and I obviously have not had the opportunity to do that yet. I have been meeting, Minister Hinari and I have been meeting with the Māori Council in order to try and remedy the issues that were being raised even before the Tribunal report came out. We know that we don't have the vaccination rate amongst Māori that we want to have. We have an opportunity with the rollout of our 5 to 11-year-old vaccines to do things a little bit differently, to target those resources into those communities more quickly at the beginning without having to, take away from anybody else. We can do that right at the beginning, and I think we will definitely want to take the opportunity to do that.
Vaccination is a highly emotive issue, though. What would you say to parents who are feeling quite nervous?
I think every parent is nervous when it comes to anything to do with the health of their children. I'm a parent. I fully understand that myself. But you've got to look at the science here. This vaccine's been rolled out widely across the globe now to young people. It is safe. I perhaps might hand it to my experts actually to talk about that as to what sort of messages that they would want to convey to those parents who are reluctant. But yeah, fire away.
Just in response to some of those things, what we find is when whānau have the opportunity to receive information and discuss information with people that they trust, then the uptake of the vaccine is very high. So our target as Māori paediatricians and other healthcare workers interested in children's health is to make that available to whānau, to fill that void that might have been there before with the correct information, reliable information from people that they trust. With respect to resource allocation, we don't see the need for timed, because there's enough vaccine, it doesn't have to be timed for specific groups, but we do see the need for deployment of allocation of resources, which might be funding for specific communication campaigns, for example. It might be resources going to Māori health providers in iwi to make sure, they may decide for their community that using kura is the best way to implement the vaccine rollout. But that's up to them to decide. But once they have that plan, that resources are available to them to support them to make that happen and be successful.
Henry and then to
Can
Newsome.
I just follow up on that? Sorry.
Yeah.
Is there money that is being ring-fenced for those resources that was just mentioned? Specific ad campaigns and stuff like that for Māori?
Well, there will absolutely be specific advertising campaigns around the paediatric rollout, and that will be targeted at those communities. There'll be different messages targeted at different communities, so there will certainly be some advertising targeted at Māori there. And with the work that we've been doing with our Māori health providers in recent months, and we've continued to increase the funding available there, we'll also be providing dedicated resource.
On the end of the MIQ changes, is that you've moved it to the end of Feb? Is that just the Australian opening date and everything else is moving too, or are you bringing them together so that end of Feb is when you're intending to open up to? At
this point, it's all together, but I wouldn't rule out further changes there to that second group if we needed to. Having said that, we don't want to disrupt people's travel plans unless there's a very, very good reason to do that. And the reason that we've chosen that end of February date is because it does mean that we can have the booster campaign well through. We can be well advanced with the rollout of the 5 to 11-year-old vaccines in terms of first doses. So all of these things cumulatively add to extra layers of protection.
Health and transmissibility, is it really that unforeseen that Omicron will get out of MIQ sometime in January anyway?
Look, we'll do everything we can to keep it within MIQ, but obviously with a more highly transmissible variant, the risk continues to increase. The infection prevention and control measures that we have in place in our managed isolation facilities are very robust. Having said that, nothing is 100% effective. And so we do have to be prepared for the fact that it could make it out sooner than that. And then,
reopening, thinking, if it's out in January anyway.
Look, I don't want to hold out something to people that may or may not happen, and so I wouldn't want to speculate on that.
On boosting booster uptake, a lot of people, about 100,000 people who are eligible for the booster right now haven't had it. Is there a certain level of uptake that you would not be happy with by the end of February? So obviously you're saying it's somewhere 80%-ish of people will be eligible by then, but probably we will like 70 or 60% actually taken it up, right?
So if we look at our Delta outbreak in Auckland, every percentage has mattered, every percentage has added, and contributed to our efforts in Auckland there. So I'm not setting a hard and fast target in terms of where we want to be by the end of February. But what I would note is I think we're up to about 95% of eligible New Zealanders now having had a first dose, and about 91% having now had their second dose. So really, I think what you can expect to see is we'll still be focused on the equity challenge around first and second doses, but most of our effort will now move to the booster campaign and to the rollout of the vaccination for children.
Just being clear, with the MIQ, when you do, late Feb or maybe March, depending where things are, it's probably got to get here, right? Omicron at some point is going to get here. Are we in a position where, by midway through next year, everyone in New Zealand will either be boosted or have had Omicron?
Look, I don't know, maybe Dr Town might want to provide a comment on that.
Look at that in Australia as well.
Yeah, we'll get out. I'll hand that one to Dr Town.
Certainly those data from Australia are pretty worrying, aren't they, with that explosive nature of these outbreaks, particularly if there's a super spreader event. But I think the Minister is right. We want to hold this back for as long as we possibly can. We know that Delta outbreak that started in August was triggered just by one incursion. And that's all it does take, of course, but the reality is that the longer we can hold it back, all of these measures that the Minister has described are starting to take effect, and the more people that have had their vaccination schedule, and particularly for our adults, these boosters, the safer we'll be. Nothing is guaranteed, of course, and the emerging data suggests that third dose really does help against severe disease from Omicron, so that's reassuring.
Yeah.
What do you think the families and the people that are stuck in places like Australia trying to get back to New Zealand and have pinned all their hopes on that, January 16th, booked flights and everything were ready to go, and now that's all been crushed.
Look, we've been working really hard to provide as much certainty to people who need to travel and who want to come home as we possibly can. And I'm sorry that we haven't been able to meet that particular deadline or that particular target that we were aiming for. One of the realities, though, is that COVID-19 continues to throw up new challenges for us. And that means that while we can work to provide certainty, we can't always absolutely give people certainty. That's not just something that's happening in New Zealand, it is happening around the world. Many of those countries that had really enjoyed opening up again are now finding that they're having to reimpose restrictions. And so, I think the whole globe continues to be challenged by COVID-19. But I want to acknowledge that at a personal and an individual level, whether it's people whose businesses are affected, whether it's people whose travel plans have been affected, people who are separated from their families, the cost, the personal cost of the global pandemic has been very high for some people.
What's the plan for when the first case of Omicron, gets into the community?
As we've indicated here, our primary focus, our first focus, is to try and delay that for as long as we possibly can so that we can get our protection rates up further through the booster vaccination campaign. We've also indicated, though, that through the traffic light framework, we would be looking to use the red setting as our first response. And then, as always, we continue to adapt and respond as we learn more. And we will know more. The international knowledge base around Omicron is still relatively new, and it continues to grow by the day. So every day that we don't have it here in New Zealand is a day that we can be better prepared and that we can have better knowledge.
Any special considerations being given to sports teams that are returning home sort of late Jan, early February?
We will have to go through our MIQ forward bookings, our group allocations and so on, and look at where the pressure points are. One of the things... you can imagine in doing this, things are moving at speed. One of the things that I will do in the next sort of 24 hours or so is work with MIQ around when we release the next wave of vouchers, because I think it's important that we do that at a time that maximises people's opportunity to take those up, if they're in Australia, for example. And it will take a little while for the airlines to figure what they're doing around flights. So I'll be working with MIQ to make sure that we're not releasing unnecessarily a whole lot of vouchers in the meantime that those people in Australia don't even get the opportunity to take up. So we'll work our way through that. Look, I wouldn't rule it out, but I'm also not ruling it in at this point either.
One more.
And
a lot of the news yesterday about Rory Nairn's death, likely from the vaccine. Do you have a message for his family, and what do you say about the risk of myocarditis?
Look, I'll hand to the technical experts to talk about the risk of myocarditis. But my overall message to all New Zealanders is that the vaccine is a very safe vaccine, and that any small risk associated with the vaccine is by far outweighed by the risk of getting COVID-19. And so vaccination is still absolutely the best course of action. But Dr. Town.
Thank you, Minister. Yes, we were obviously deeply saddened with that report. We do have the benefit, of course, of the Independent Safety Monitoring Board, which has met, and I sit in on those meetings, which is helpful to understand their evaluation. So what they determined was exactly as the Minister has said, although this particular case was probably associated with the vaccination, it is extremely rare internationally. And the risks of getting COVID, which itself can cause myocarditis, as the Minister has said, certainly outweigh that. The boosters themselves, it's very early days, but we're obviously alert and monitoring safety signals. We think it's unlikely that the booster dose would trigger myocarditis, which, as you know, is more common, in fact, after the first dose, as in this sad case.
Mark.
Do you have a sense, how confident are you that the red light setting will be enough to control Omicron? It's kind of like putting all of our eggs in the vaccination basket, and we know that, even 2 doses of Pfizer, even without waning, only 35% effective against infection.
One of the things that we will know more about as the coming weeks go by is what the big spike in case numbers that we're seeing around the world does in terms of hospitalisation, in terms of severity of illness, and information there is still quite early, and so we indicated when we went to the traffic light system that we will sort of move away from the daily case numbers being the main measure to looking at things like severity of illness, the number of people in hospital, the number of people in ICU, and so on. Now, Omicron has changed the dynamic there a little bit in the sense that we know that people who have been fully vaccinated, i.e. have had the 2 doses of the vaccine, can also be getting it. And we've seen examples around the world of people who've been, had those 2 doses getting it and still getting sick from it. And so that's why the boosters become all the more important. But we'll know more in coming weeks. But the main message in the meantime is that the boosters really matter.
Would you be open to layering more public health measures on top of it, returning to that sort of Swiss cheese approach, like people like Michael Baker have called for?
Well, I think if you look at the Swiss cheese model that we've got now, we do have a variety of different protections. So we've got masks, we've got, at the traffic light, within the traffic light setting, there's places that you can only go if you've been fully vaccinated. There are a variety of different layers of protection, and of course you can continue to add more layers of protection. What we don't necessarily want to do, unless we absolutely have to, and I'm not saying that at this point we're envisaging doing this, we don't want to have to go back to the alert level system. It is there, as we said when we set out the traffic light framework. It's still there, it's still available for us to use, but we would only do that if we absolutely had to.
Minister, do you think now that MIQ needs to be expanded, or you need to look at it as more of a permanent thing, given we've got another extension for the use of it?
We're still intending, of course, to have home isolation as the default setting for people coming into the country. Now, that's been delayed by about 6 weeks, from the middle of January to the end of February, but that is still what we're planning towards. Managed isolation, MIQ, for the travel across the border of the scale that we, ultimately need to get back to, would be incredibly huge. It would be big, really big. I think what we have been working towards, and we've been working towards this for some time now, is that overall kind of contingency planning for the future. So what sort of capability around managed isolation and quarantine do we need to have, not necessarily just for this pandemic, but for future pandemics? And so we're working our way through that. So yes, there'll be further changes there, I think, is the ultimate answer.
And what advice did the Cabinet get about the wider effects of a delay in opening the border, in particular well-being effects on mental health and also the economic effects on the economy?
Difficult to model the well-being effects, but we do acknowledge that there are well-being effects, that for families who are separated, for people who find themselves in a place where they didn't expect to be for a prolonged period of time, the mental health and the well-being effects can be quite significant. And so we do very much consider that, but we also weigh that up against the potential effect of a large-scale outbreak and the potential well-being effect that could have on an even greater number of people as well. So there are no easy choices here. In terms of the economic effect, we do know that there is an economic cost to restrictions at the border, but again, the cost of that, at least in the short term, is less than the cost of, say, a level 3 or a level 4 lockdown. And so the more we can do to avoid that, the better for New Zealand.
Yeah, so just on childhood vaccination before the school year starts, what sort of modelling are you seeing about primary schools being used as a vector for the disease, and also do you have like a minimum amount of kids that you want vaccinated, and if you don't reach that, would you look at potentially delaying the start of the school year?
Look, I want to be absolutely clear about one thing, which you'll note I put in the statement. We will not be making it mandatory for young people to be vaccinated. This will ultimately be a choice for their parents. It's a choice that I strongly encourage parents to take. It protects their children. It protects the family, it protects the more vulnerable in their family, including grandparents, for example, or those who may have underlying health conditions. So strongly encourage families to do that. We're not setting a target for the childhood vaccination. We just want to vaccinate as many as we can. There's a lot of water to flow under the bridge over the next month before we started to think about any changes to school opening dates. I'm not contemplating those at the moment, though.
Why not make it mandatory?
Look, we would not make it mandatory for children to be vaccinated. We haven't made it mandatory for the majority of New Zealanders to be vaccinated either, to be clear. It is those where there's a risk profile and a public health justification for doing that. Yeah, there you go. Over in the far corner, and then I'll come back to you again.
What options are on the table for people who have booked flights to come home from Australia from the 16th, who are now sort of in limbo? What options do you have for them in terms of repatriation?
Like I said, we'll be working closely with the airlines to make sure that we can align release of MIQ vouchers with flight availability. So one of the challenges, if we released a whole lot of MIQ space at the moment, and there will be pressure on MIQ given the increase back to 10 days for isolation there, but we will still have some availability. When we release that, we want to make sure that those people who are in Australia can get access to that. And of course, the emergency allocation criteria continues to be in place. So for those who have a critical need to get back, they can still apply for emergency allocations.
Any idea of the number of rooms that you would be able to allocate to people coming home? Capacity is left in the system.
Well, I can tell you that in the most recent lobby release, there were 500 rooms that didn't get taken at all. So the demand has just absolutely disappeared since we made the announcement. And I expect that some of that, some people will be in a position where they will just delay their plans. So, but there will be others who there will be more pressure on. So they'll be looking to either secure a voucher or an emergency allocation. And so we'll be working with the MIQ team to release those vouchers at a time when people have a chance to be able to get them if they're travelling from Australia.
And you made the point that we still don't really have much firm data or information on Omicron and how severe an outbreak could be. How dynamic is your risk assessment of it, and how flexible are you to changing to more strict measures or less strict measures as the data becomes available?
I think with all things COVID, I've never ruled things in or things out, because we do have to be adaptable and flexible. Things change all of the time when we're dealing with COVID-19. Sorry, I said I'd come back to you.
So how concerned are you, though, about the risk of Omicron or Delta spreading throughout a school? Like, how much of a risk does a school setting pose for that?
I might ask our experts to comment on that.
We are concerned about outbreaks in schools. We know that transmission does occur between children and from children, probably less than in adults. But we're certainly, one of the factors considered in the decision for paediatric vaccine to be made available to children was the possibility of outbreaks in schools and the virus basically circulating around schools and being a hub within communities. So definitely a consideration in the decision.
And can I just ask you quickly about the border as well, because people are really disappointed that, that it's another delay. Should people be expecting every time there's a new variant that there's going to be a delay in the border reopening?
No, not necessarily. Now,
what, if any, changes will be made to the countries designated as very high risk, considering Omicron is everywhere now?
Yeah, most of those countries that were designated as all those countries that were designated as very high risk off the back of the Omicron variant have now been reclassified as high risk. There isn't a justification any longer to treat them differently, given the rapid spread around the rest of the world.
Centres have Omicron in them with MIQ. Is there in Auckland, Wellington and Christchurch now, or how widely spread is it across the country?
I think from memory, at least I can think of 4. So it's pretty much across the MIQ network.
And in terms of the boosted, at the moment, double jab to get into a lot of places. Can you see a point where we will have to be triple jab to get into places?
Quite possibly, and with the vaccine certificate framework, when we release your vaccine passes, they've got a 6-month expiry on them, so that we have that opportunity to make those sorts of decisions.
Minister, will you look to bring 5 to 11-year-olds into the vaccine pass framework?
No.
And secondly, once we get over 90% triple dosed, does that give us enough protection to be able to remove these border controls?
Look, it's still all, there's still so much that's unknown, but we're still aiming towards that end of February target to be able to have self-isolation in the first instance. We want to get to the point where we can have free movement across the border again. I don't know when that will be. It's likely that it's going to be a staged approach, and home isolation is likely to be the first sort of significant step in that.
The Waitangi Tribunal report also spoke about Cabinet's refusal to take on official advice. Why is it that the government continues to refuse to take on advice from Māori health providers or the likes of Te Rōpū Whakakaupapa Mate Uruta?
As I've indicated to you before, we get quite a significant range of advice. We made the decision around the initial vaccination rollout, given the limited supply, to roll out the vaccination initially to those who were most at risk of getting it in the first place, so those who are working at the border, those who are working in our frontline health roles. and to our older population, on the basis that we know, from international experience, that is where it does the most damage. And also then to those with comorbidities, so those who have underlying health conditions. So we made that sequencing decision in the context of limited supply. Now, I think we're fortunate in the next phase of our rollout, where with boosters and also with the 5 to 11-year-old vaccines, that we won't have to ration in that way. And so we can, I think, take a different approach now, which is, and it does mean that we can put equity front and centre right at the very beginning.
For Dr Delore, you're embarking on the vaccination rollout for tamariki Māori. How confident are you that the advice and the guidance that you're going to be giving the government will be taken on board?
I think the early indicators are good, because the findings of the Waitangi Tribunal, I think they are a template for us to identify the problems or areas that were deficient in previous rollouts of vaccination. A lot of Māori organisations, a lot of Māori healthcare professionals who presented at the hearing for the Waitangi Tribunal, we're going to be using those findings to hold the government to account, to form a vision for how this vaccination rollout for 5 to 11-year-olds can be much more successful.
Dr. Delore, finally, we've been speaking to some hospitality workers who are really up against it. They're feeling the pressure. They're getting tired of the aggression, of the abuse when asked for people to provide their vaccine passes. What advice do you give to these businesses?
It's not so much advice to the businesses as a request of all New Zealanders. We're heading into Christmas. Relax, be kind, be understanding of people who are doing their jobs. They're not doing this because they want to. They're doing this because they're required to. And so, just to everybody else, cut our hospo workers a bit of slack. They're doing their jobs. It's a tough job. It's been a really tough couple of years for them. And so embrace the festive season and show some kindness.
In regards to the Waitangi Tribunal report, we've already gone over it in terms of why you decided to go against the advice you were given, but do you regret that decision?
As with all things COVID-19, there are always things that you look back on and think, I wish I had better choices when we made those decisions. Now, we made those decisions in the context of a very limited vaccination supply early on. We don't have that now, and so we're able to make different choices. And I'm absolutely confident in the choices that we're making around, this next vaccine rollout, that some of those equity issues that we encountered in the first part of our vaccine rollout, we can avoid them this time around.
Is the government racist?
No, I don't think so.
A question for Dr. Tan. The Gauteng in South Africa, sort of the epicenter of their Omicron wave, seems to have turned the corner. The cases are flattening and falling now. What do you make of that? Is it possible that Omicron sort of spreads like wildfire and then sort of fades just as quickly?
That's a really interesting question, isn't it? Probably one more for the new year. I think the situation in South Africa is really quite different to what we're seeing in Europe, particularly the UK at the moment, and in Australia. There, of course, the number of people who've experienced COVID is very high, so they have natural immunity as well, and the vaccination will have topped that up. So I think that dynamic is very much in a previously infected population, and yes, the initial wave seems to be flattening, but I think more worrying for us is what's happening in Europe, in Australia, and places where people come to New Zealand from, because that'll be the risk that presents at our borders.
All right, we might wrap up shortly, but Janae, I haven't had a question from you. I think you arrived late, so...
Yes, I did. I was busy writing the news. The border opening, for people, New Zealanders, anywhere around the world other than in Australia, can you be any more specific when you think they might be able to come in without having to go into MIQ?
So like I said, we're now aiming towards that end of February date for home isolation to be the default for those coming into the country who are New Zealand citizens who have a place where they can home isolate.
So that's for people coming from Australia and other parts?
Yes.
Change the MIQ for 7 to 10 days. When is that going into effect? The people in MIQ now going to have their stays? It'll
be those who, it's prospective, so it'll be those who are arriving after the date in which that new requirement comes into effect. So we've got to go through the process of changing the order. So it'll be, that will come into effect in the next couple of days, and it will be for those arriving after then changes come into effect.
Yeah, now we have to have a longer stay or anything.
But what if-
they're the same.
That's right.
But what if you've got Omicron in the MIQ facility?
Then they're subject to a different set of rules. So for those who are close contacts of a confirmed case, then they stay for the full 10 days.
Speak a little bit more about your willingness and Cabinet's willingness to use more strict measures. It seems like your overall message is basically, we don't want to do lockdown at all over the summer. Even if Omicron gets out, we'll use red instead, unless some drastic news about how bad Omicron is. But on the current data, would you lock down if you got a message from actually Olympia tomorrow saying we found 2 cases of Omicron in the community?
No, I think the red traffic light framework is our go-to, at least initially, and we'll see how things unfold from there.
Question for Dr Delore. Has there been any advice given to the government to prioritise vaccinations for tamariki that was rejected? Did you give any advice to the government to essentially work even harder to get to tamariki before the rest of the population, to prioritise them?
From my perspective as a Māori paediatrician, there's only a small group of us. We have given advice through the COVID Technical Advisory Group, and it wasn't that specific, but it's certainly our wording is to prioritise vaccination for tamariki Māori 5 to 11, and how that happens, as I said before, is not so much the timing of it, because there is plenty of vaccine available, but it's where the resources go to.
And do you think the government is complying with that?
Well, as I said there, I think the indications from the government are that they are listening, that they're taking on board those lessons from previous vaccination rollouts, and so I'm positive, and I'm encouraged by what I've heard from the government so far. I would point out that there are a lot of other Māori organisations who are working with the government now about what role they will play in the paediatric rollout of vaccination. And I can't speak for those groups, but I'm sure that we will be hearing from those people in time. And as the weeks go by towards the start of this vaccination program, we'll find out more about what the government's commitment is to meet.
Just finally, in your opinion, do you think the government's response now is still complying with the treaty principles, or is breaching?
That's a hard question. I would like time to go through the findings of the Waitangi Tribunal. I think there won't be a point where we say we're completely happy with the vaccination rollout for Māori. We're going to keep pushing. We're going to be looking for new ways to do things, new ways to achieve those equitable outcomes, particularly for tamariki Māori.
All right, thanks very much, everybody.